Hi all, we're going to go ahead and get started here. This is Caitlin Snyder with the National Housing Conference, and in the room I have got Janet with the National Housing Conference. She is our senior researcher, and on the phone I've got Lisa, and she is our vice president for research here at the National Housing Conference. So they've got a great presentation for you today on anchor institutions and community development, and we'll hear from them in just a few minutes. To start us off, I've got some policy updates. So the biggest thing happening right now in Congress is the highway bill. We expect that the highway bill will get passed in the House today and get passed in the Senate tomorrow or early next week for the president's signature tomorrow or early next week. The current federal highway funding is set to expire tomorrow on Friday, December 4th. So they need to pass this or else there will be a lapse in funding. The proposed bill that they will be voting on is for 5 years and is $305 billion. And of note, this federal highway funding bill does not pay for itself with a rise in the guarantee fee. Rather, it taps into the Federal Reserve and the gas tax. And earlier versions of the bill had a rise in the GC that National Housing Conference and other housing groups were opposed to, so we were really happy to see that out of there. The second biggest thing happening right now is the budget. So currently the federal budget is set to expire on December 11th, next Friday. So between now and next Friday, we'll see a lot of work to hopefully get a budget passed so we don't have a shutdown. Senate Majority Leader Mitch McConnell and House Majority Leader Kevin McCarthy have each discounted the possibility of a shutdown in recent public statements, but there has been no public announcement of an agreement as of yet. So we expect that 302B's allocations or subcommittee allocations will be made public any day now, possibly simultaneously with appropriations bills that are currently under negotiation. We're not sure if we're going to see one big continuing or one big omnibus or a bunch of smaller bills. But complicating the matters are some policy riders around Planned Parenthood, the repeal of the Affordable Care Act, and the policy on Syrian refugees. So we're going to see what happens, and so far the Republicans have offered the Democrats a deal and the Democrats have rejected it. So I think we'll see some back and forth in the next couple days around negotiations, and hopefully we can get a budget before next Friday. And the last thing we have for policy updates is tax extenders. Tax extenders expired last December and require renewal by Congress to be effective for 2015. The tax extenders include the fixed 9% rate for the low-income housing tax credit, the new markets tax credit, the Mortgage Debt Relief Act, and other housing provisions. Like last year, some lawmakers are hoping to make some of the expiring provisions permanent, but if they fail to reach an agreement, another one-year extension is likely. So NHC is encouraging all of its members to support the permanent minimum housing credit rates to the House and Senate members. And with that, I want to go ahead and turn it over to Lisa and Janet. And I just want to preface their presentation by saying this work really came out of our Solutions for Restoring Neighborhoods meeting that we held last month in New Orleans. Janet held a housing panel and identified a gap in the field, and this work is really an attempt to fill that gap on the role of anchor institutions in restoring neighborhoods and the partnerships between anchor institutions and housing and community development groups that can be fostered. So with that, turn it over to Lisa and Janet.
Land use, zoning, financial, and other sorts of tools that have been effective on creating opportunities for housing at the local level for folks from all backgrounds. And then finally, we do work around, in general, about housing demand, forward-looking, what kinds of housing will be needed given changes in the types of jobs in the community, what do changing demographics mean for housing demand, those sorts of questions. But the housing intersections area is really where Janet has been taking the lead around some really interesting work on specifically the relationship between housing and health, and this growing awareness that housing is really an important social determinant of health. And this has been reinforced by a lot of the research that's coming out from Raj Chetty and the Economic Mobility Project on the importance of place to outcomes for families and children, particularly outcomes related to health. And so we took on this project related to anchor institutions because there was a sense that they could play an important role in comprehensive community development efforts and really be a catalyst for change in ways that could make places provide better opportunities for families and for children and individuals and workers. And there is growing interest in the role these institutions can play in community and local economic development. And there is a specific environment with the adoption of the Affordable Care Act that Janet will talk about that makes this timely to be talking about the role that health institutions in particular can play in affordable housing and community development. So on the next slide, just to talk about what we mean by anchor institutions, that's a phrase that's used a lot, and I thought it would be a good idea to provide a brief description of the characteristics that are generally used to classify an organization or an institution as an anchor. So you can think about how these characteristics might describe an organization in your community, and then we'll talk about why these things are important in terms of them being good partners on community development. So an anchor is generally a large organization. It's usually a public or nonprofit organization. And this word anchor comes from the fact that it's physically anchored to a particular neighborhood, meaning that it's unlikely that it will move. You know, some companies have been in a neighborhood for a long time, but that they may be willing and able to move if the economic winds change. And so this is an organization that has been committed to a neighborhood and has been there and is anchored then to the neighborhood. And it is largely because it has this long established presence in a community. Many cases, these are institutions and organizations in cities that have sustained even while the rest of the city might have experienced decline, sometimes decades of disinvestment, employment losses, might have been existence in the city when there was population loss. So these are institutions that have an established presence in the city, which is important to their being partners in investing in the city. Anchor institutions are major employers. So there was a recent research report out by the Initiative for a Competitive Inner City, which found that when they looked across the 100 largest inner cities in the United States, an anchor institution was the largest employer in 66 of them. And so, you know, we've sort of been vague about the types of institutions, but these are often large hospitals, these are large universities, these can be other large organizations like foundations, but health institutions, hospitals, universities, and other institutes of higher learning really make up the bulk of the types of anchor institutions that fit these definitions. They are not only a major employer, but they also tend to be large landholders in a city. They have can have a lot of land, and that makes them have opportunities for real estate development and other partnerships around development. And because they're large and because of their major presence, an anchor institution really has is an organization that has sufficient scale to bring together economic and financial assets, human resources, and physical structures from throughout a community. So, you know, as a result of these characteristics, there's a lot of potential for an anchor institution to have a big impact in their community. And we're in a particular period where health institutions may be looking for ways to get more involved in community development and in affordable housing specifically. So we'll talk more about that in a few minutes. But if we go to the next slide, there is a long history of anchor institutions partnering and providing services and getting involved in local communities. They've been active roles as well as more passive roles, and the type of role that an anchor institution can play really depends not only on the community and the community needs, but also the type of institution itself. So different organizations that study anchor institutions have suggested that there are several specific roles that anchors play in community and economic development. They can serve as community infrastructure builders, providing resources and expertise to build up capacity in the community. They often serve as a provider of goods and services, so they may tailor whatever products and services that they're involved in to meet the needs of the community. As I mentioned earlier, often an anchor institution has large control over land, and so sometimes anchors serve as a real estate developer. An anchor is a purchaser in the community, can support the community by buying goods and services from local businesses. They offer employment opportunities, they can provide workforce training, and anchors often serve as a business catalyst for growth of related businesses and institutions in the community. So hospitals and other health institutions, which is what we're going to talk most about in this presentation and in our report, have served in all of these roles, but according to the researchers that have studied these institutions, they have historically been most likely to serve in the roles of a provider of goods and services, a purchaser, an employer, and a workforce developer. Based on a review of institutions' role in community development, universities and other educational institutions have been the ones more likely to serve as a real estate developer and have partnered with other public organizations on housing and other real estate development to a greater extent than health institutions and hospitals have in the past. So those are some of the roles, and if we go to the next slide, it's this general idea that we're using as the basis for the report we're writing on opportunities for folks working in affordable housing and community development to partner with anchor institutions, specifically health institutions. And anchor institutions, like I said, have gotten involved in community development efforts in the past, but they've often been sort of one-off efforts, or they've been tied to a specific incident, or there's been some philanthropic feeling on the part of a particular institutional leader. But there's this relatively new paradigm for understanding the potential role anchor institutions can play in building successful communities and revitalizing neighborhoods. And economist Michael Porter is really the leader of this theory, which relates place-based institutions, or that is anchors, relates their possibility to the prospects of improving local economies and local communities. And he's defined this concept of shared value, which is, he's defined as policies and operating practices that enhance the competitiveness of an institution while simultaneously advancing the economy and social conditions in the communities in which it operates. So, this notion of shared value just suggests that when anchor institutions and communities work together to overcome challenges or disinvestment, the institution can receive or realize a tangible, often economic benefit to its efforts. So there's not just a philanthropic reason to be engaged in community development, but it actually may be good for the institution's bottom line. So this idea of shared value or enlightened self-interest is not necessarily new. In the 90s, there's evidence that many institutions in high-crime urban neighborhoods were working with nonprofits and others to improve conditions around their facilities to make the conditions better for people that visited their facilities, including their employees, the people it served, visitors. But many have noted that we face this sort of a critical juncture for relationships between anchor institutions and inner cities, as inner cities are revitalizing and helping to restore neighborhoods. There is a particular point in time related to healthcare that makes this an even more interesting time for understanding how to bring anchor institutions into the community development sphere. And there's a key provision related to the Affordable Care Act, which Janet will talk about more here on the next slide, but that creates opportunities for health institutions to be more engaged in community development work. And so what there are now are there new regulations, or there are sort of enhanced regulations about what institutions must do to maintain their nonprofit status. For example, if they're a nonprofit hospital, there have always been things that they've needed to do to maintain that tax status. But the Affordable Care Act, as Janet will discuss, has evolved that those requirements in a way that creates some new opportunities for health institutions. But even though there's regulations and even though there's requirement, I think it's important to think about keep this shared value idea in mind, because if the only reason an anchor institution is going to work in the community is to check a box on their tax form, then the potential for having long-standing impacts in the neighborhood are lessened. So it's important to approach the idea, and by approaching the idea, that for someone working on affordable housing or in community development, to approach an anchor institution as though there is a shared value. There is a value for that institution in working with them on investments in the community. So with that as some background on what an anchor institution is, some of the roles they've played, and then this concept of shared value for moving forward and working with anchors, particularly health institutions, I'd like to turn it over to Janet then to discuss the specific opportunities nonprofit health institutions are facing now in this new healthcare environment. So Janet, I'll turn it over to you.
Thanks, Lisa. So I want to start off by talking a little bit about this requirement that Lisa mentioned, which is often referred to as community benefit requirement that applies to nonprofit hospitals who want to receive a federal tax exemption. Historically, this has taken the form of these nonprofit hospitals offering free or discounted health care. And it's important to keep in mind that today I'm just going to talk about the federal tax exemptions, but many states and localities also offer tax exemptions to nonprofit hospitals with their own stipulations and requirements. But this requirement has evolved over time. Initially, as I mentioned, it started with offering this free and discounted care to provide a benefit to the community that justified its tax exemption. But with the creation of Medicaid and Medicare in the 1960s, this idea of community benefit grew beyond just providing free healthcare services to really thinking about what kinds of other activities and spending supported health in a community. As more people receive healthcare coverage, they have lesser need for free and discounted healthcare. And so it was around this time that the eligible spending and activities expanded beyond just clinical care to what's referred to as community building activities. And this really is a broader view of what creates a culture of health in a community and covers activities and spending in the area of housing, economic development, environmental improvements, and community supports. So really addresses what is often referred to as the social determinants of health, things that determine a person's outcomes to a large degree beyond kind of your typical view of healthcare services. Now, this has evolved over time, but in particular with the passage of the Affordable Care Act, or the ACA, there have been some really significant changes in thinking about nonprofit hospitals in this community building role. In many states, the Affordable Care Act has dramatically expanded eligibility for Medicaid, and so millions of people now have health care coverage that didn't before. So particularly in states where Medicaid was expanded to cover low-income adults that previously weren't covered, you have a far lower number of individuals who have a need for this free or discounted care. But you still have nonprofit hospitals that need to maintain their tax exemption. And so they still need to be active and investing in this area of community benefit. And so increasingly, they're going to need to think about this community building piece as they provide less free and discounted care, what's often referred to as charity care. They need to think about where they're going to invest in community building. And this is critically important when you're thinking about community development because there's a huge overlap here. So with the Affordable Care Act, not only are more people being covered by health insurance, but there's also some new specific requirements for nonprofit hospitals in this tax exemption under community benefit that is really designed to enhance transparency in how their community is benefiting, but also increase engagement in the community when they're thinking about this benefit. And so the Affordable Care Act now requires that nonprofit hospitals complete a community health needs assessment at least once every 3 years. And this is a process through which they are required to engage community stakeholders in assessing key and significant health needs in their community. And the idea is that they need to broadly think about health in the people that they serve, in the community where they are located. And then not only do they need to identify key health needs, but they also need to create an implementation or an action plan, which lays out how they're actually going to address some of these needs that have been identified. And so this really lays the groundwork for a lot of these community building activities that hospitals are going to engage in when they're thinking about the social determinants of health and some of the key needs in their community. They're going to make some decisions about what they're going to invest in. Are they going to invest in housing interventions, economic development, environmental improvement, community support? And so this is really where a lot of community development organizations can connect with these nonprofit hospitals. There's a few examples that I want to briefly highlight of 3 hospital systems that have been not only anchor institutions in their community, but have really engaged in this community development work even prior to the Affordable Care Act. And I think it's important, as Lisa mentioned, to think about them in terms of this idea of shared value. So not only were these organizations clicking the box that they've been doing their community building work, but they've also really seen themselves as critical partners in community revitalization. So the first example is Stamford Hospital in Stamford, Connecticut, which worked closely with Charter Oak Communities, the public housing authority in that community. They were located very closely nearby each other. There were 2 major anchor institutions that had developed an informal relationship among their leadership. And both organizations embarked upon their long-term physical planning process around the same time in the early 2000s. And so as Charter Oak Communities was utilizing a HOPE 6 grant and redeveloping decaying public housing, at the same time the Stamford Hospital was looking at its own long-range physical needs and thinking about how it was going to expand its campus and enhance its physical assets. And so this relationship evolved into a land swap. The Charter Oak Communities was able to use land that it had gained from the hospital in order to scatter the sites of its new mixed-income housing. And Stamford Hospital was able to gain a parcel of land right next to its campus to expand its facilities. So out of this partnership in terms of a transactional land swap, it evolved into an even closer collaboration where the organizations realized they had taken a major step in addressing some of the key physical needs when you think about social determinants of health, but really were able to then think about the next step, which is the programming needs and the service needs. And so this land swap evolved into a partnership and a more extensive effort from both organizations to create a health district that included an urban farm and nutrition programming, health programming, workforce development, and a more comprehensive approach to thinking about what the community needed aside from just a physical building. The next example is Bon Secours Hospital System, which is a national system, but in Baltimore in particular, the hospital system had a very strong social justice mission and really saw its role as improving the health and well-being of its community. The organization is run by a religious order that has that mission. And so what it did over time is identify that one of the critical needs in the community was safe and affordable housing in West Baltimore. And so initially it partnered with organizations on affordable housing development. And over time, the foundation arm of the hospital system developed its own capacity to serve as a developer in its own right and to not only develop affordable housing but also own and operate it, which is a very hands-on role when you think about hospitals engaging in something other than healthcare. and really thinking beyond just that anchor institution of we are a hospital within these four walls, but we are an important player in our community. And then finally, I want to mention the Henry Ford Health System in Detroit, Michigan, which initially got involved in some of these community development initiatives through employer-assisted housing programs. So we're seeing how they could attract and retain employees through home buying assistance, renters assistance, and help stabilize the community by reducing vacancy. Now this role evolved as the health system thought about its greater health goals. So the Henry Ford Health System ran a PACE program, which is the Program of All-Inclusive Care for the Elderly, which is a program that tries to transition elderly who are Medicaid and Medicare eligible out of nursing homes and back into the community. And the health system found that one of the major barriers to expanding this PACE program was the lack of affordable housing that was appropriate for older adults in their community. And so they partnered with experienced affordable housing developers to greatly expand the number of affordable units in their community and to create a second site for their PACE program. So developing housing to help expand their own programming and achieve their own health goals. So these are three very brief examples of these, what you would think of as typically health groups really serving a critical role in community development. And so thinking about how these organizations went from what we think of traditionally as a hospital that provides health care and that's it, to a community development partner, I think it's helpful to think about how other community development organizations can approach hospitals in their community and how you can help them think about their role as being beyond just a healthcare provider within their own physical walls, but to think of themselves more like these other organizations. And so there's a couple of steps that came about in terms of how do you leverage this requirement that nonprofit hospitals have into a conversation about that shared value that Lisa mentioned. And so the first step, I think, is to start with a hospital's community health needs assessment. So by this point, most of the nonprofit hospitals will have already completed at least one. And it will educate a community developer about the health needs in their community and also help them understand what hospitals are prioritizing, what the hospitals see as key needs and important social determinants of health in the community. And then the next step is to review your own organization's mission and expertise and capacity and see how it aligns with some of these health needs that have been identified and these social determinants that have come up in the community health needs assessment. And then the next step is to reach out to the hospital, which is often the most challenging step because a lot of these health systems are quite large. And so it's helpful to see if you can locate the person at the hospital system who's in charge of that community health needs assessment. They're going to be best placed to understand not only the hospital's requirements, but also the hospital's vision for what kind of role it wants to play in the community. And once you make that connection, the next step is to really have that discussion with the hospital system about how you can help them achieve their goals. It's a big challenge for a lot of hospitals to see themselves as something other than a healthcare provider, and often they might balk at the idea of requesting funding or things like that. But if you can help them understand how you can help them achieve the goals outlined in their implementation plan and their action plan, and really help them to understand their role in the community and the part that they play in community development, you have a much better shot of creating a relationship that can turn into something more comprehensive. And so with that, I'm going to turn it back to Lisa.
Great, thanks, Janet. And so just to sort of wrap up here, we hope that you'll take a minute and look through the presentation, but stay tuned for the report that we will hopefully be releasing in the first part of the year, in January or February. But I did want to draw your attention to some other research that's come out recently around anchor institutions that we have been making use of, but that is also been really interesting to read in light of the Affordable Care Act's community benefit requirements. And in particular, the report that's listed at the top, supported by the National Resource Network, that talks about cities and anchors working together. And it's not specifically about health institutions, but it provides some really interesting way of thinking about building this shared value and about making the organizations that are doing community development work understand how they can help educate health institutions and other anchor institutions about the benefit of participating in community development efforts as well. So with that, I think I'm turning it back over to Caitlin for any questions or follow-up.
Yes, thank you, Lisa and Janet, so much. So we have some time now for question and answers, and I have a few to get the ball rolling, but I'm looking at my folks in the room in case they have any. So one to get started with is, for either of you, what do you think is preventing these anchor institutions and these hospitals from taking an active role as a partner and them making the initial step in this community revitalization effort?
I can take that one, Lisa. I think that we have to understand that silos are real, and hospitals' expertise is in healthcare. This is what people who work at the hospital train in. This is what they understand. This is what they're comfortable with. And there isn't a tradition in healthcare of being a community developer. I think there's also a fear of getting in over your head. I don't think many hospitals would be comfortable engaging in activities in which they don't feel they have an expertise. Or they may not even understand the influence they have. And so I think it's a big barrier to helping hospitals and healthcare providers in general seeing themselves as part of the bigger picture, and thinking beyond these silos and thinking more in terms of social determinants of health, and a little bit less in terms of healthcare, because when you think about social determinants of health, you realize that housing, economic development, workforce development, this is healthcare in a sense. By providing these services, you can help improve health outcomes for individuals. And so I think that first step is helping hospitals to understand their role and their power, but then also letting them know how you can support them. There is a huge amount of expertise among community development organizations. And so helping them to understand that they don't need to be an expert in every area, but that there is a real possibility for true partnership and leveraging joint expertise and resources and really engaging with our community in a meaningful way. Thank you.
And Caitlin, the only thing I would add, and Janet may be able to say more about this if people are interested, I think there's, in light of the community benefit requirement under the ACA, I think there's still a little uncertainty among nonprofit hospitals about what will count towards their community benefit contributions for their nonprofit tax exemption status. So I think that as more and more hospitals start engaging with communities, I think it's really important for us to continue to track that progress and to document those partnerships and to highlight successful efforts so that more hospitals feel comfortable that their activities will not only serve their community but will also be consistent with what their requirements are under tax law.
Great, thank you. I just wanted to let folks on the webinar know that you can submit the question through the webinar software. There is a feature where you can ask a question, and if you type it in there, we will get a notification and ask the question for you. So I have another one for Lisa and Janet. How can you build shared value around affordable housing?
So I can start with this, Janet, and then if you want to chat, jump in, please do. But I think one of the things that that's really important, and Janet alluded to this, is to make the case more strenuously about how housing serves as a social determinant of health and how access to safe, affordable, and decent housing really results in more positive health outcomes for individuals and families, and that it's this idea of housing as a vaccine, which has been made, which is something that Megan Sandel talks a lot about, Dr. in Massachusetts talks a lot about housing as a vaccine, and this idea that housing can really be a preventative measure for negative health consequences in the community. So there's a couple of reasons why that's important to an institution and would benefit them at the end of the day. First, if they're serving that community in which they're located, by having a healthier community and having people living in safe housing and in decent housing and having improved health outcomes because of that housing, then their health care costs will be lower. So they'll be less expensive to treat the community in which they're serving. And the other thing is, if people live in safe and affordable and decent housing, then that neighborhood is a place that people want to come to. It's a place where there is more investment. It's easier to attract employees, nurses, doctors, physician's assistants, and so on. And so by investing in helping to improve housing conditions, you actually make the place, the neighborhood, a place that is more attractive and potentially safer and a draw, frankly, for employees of the hospital or the other health institution. So I think there's at least two reasons you could make the case that it is in the interest of the hospital to be engaged in community development efforts, both in terms of improving the health of the population they serve and creating an environment in which they are better positioned to attract workers and other patients. So I'll leave it there, but Jen, I didn't know if you had anything you wanted to add.
Yeah, there's another thing that comes to mind that's more specific, but still, I think, very important to hospitals, which is some of their new requirements under the Affordable Care Act is to reduce preventable readmission to the hospital. And so hospitals are facing penalties if they have too many of these preventable readmissions. And a lot of times, people's ability to recover and become healthier and stronger at home after they've been discharged is having a home to go to, having a safe home to go to, and not having the stress of housing instability or struggling to afford their housing. And so that's one way that hospitals can really draw it to their own bottom line. Even though it's not applicable to everyone, it's certainly something that might be a bit more concrete for hospitals when they think about the role of affordable housing.
Great. Thank you so much. Well, I'm not seeing any more questions in the room or online. So we just have a few quick updates, but I wanted to thank Lisa and Janet so much for their presentation, and we really look forward to the research report that'll be coming out in January or February, and we will make sure that you all get a copy of that research report.
Thanks, Caitlin.
So I just wanted to do two quick partner updates. So National Housing Conference has set the date for our housing communications convening, and that will be in April from the 28th to the 29th in New York. You can register for that today.
I believe so.
I think so. You can register for that soon, but we have selected the date and we have selected the location, so we're really excited about that and for the housing communications team, and we think it should be a really great convening. And just so you all are aware, we just held our Restoring Neighborhoods Conference, Solutions for Restoring Neighborhoods Conference, and we are planning one for the next fall. We don't have a date yet, but just keep your eyes out for something coming shortly. And with that, I hope you all have a nice rest of your day, and thanks for tuning in. Bye-bye.